One of our goals with our Clean and Clean Out program was to really involve everyone in the hospital, all hospital employees, that they all have a role to play in patient care. We didn't just track our compliance observations, but we tracked how many unique observers we had from different locations in the hospital and also within a job classification. And we were able to statistically see an improvement in hand hygiene compliance the more unique observers that were involved within a job class. We started in 2013, and we started just with inpatient units because it was the kind of clearest way to think about going in and out of patient rooms. It was so successful that year that a number of outpatient and procedural areas asked to be a part of the programs. After the first year and a half, we were able to do this analysis that we recently published. And in the analysis, we were able to show something that no hospital has been able to show before, which is that even starting at an already high level of 80 to 85% hand hygiene compliance, it does make a difference in reducing our healthcare associated infections when we go to an even higher level. And I think that's a really important point because sometimes I think infection preventionists have trouble getting increased enthusiasm about hand hygiene, particularly when they're already at an almost high level. For a 10% increase in our hand hygiene compliance, we saw a 6% decrease in our overall healthcare associated infection rate. We also saw a very similar trend with our C. difficile infections. During that same time period, we saw 197 fewer infections, which resulted in 22 fewer deaths and about $5 million saved in avoided costs from infections. Now we're almost starting our fourth year, and we have 300,000 observations that have been done. We have more than 7,000 unique observers who have been a part of this program, and we have sustained more than 90 to 95% compliance for over 30 months now in the inpatient setting, outpatient setting, and in the operating rooms.
Some of our nurses have been here 30 years. Some of them are brand new, straight out of nursing school. And so it's very scary for a new grad to say to that 30-year experienced nurse, "I'm sorry, but you didn't wash your hands. Do you mind washing your hands?" And the same goes for those NAs compared to nurses. I think there's this natural hierarchy that is just assumed. And when you can level the playing field and take that out, then it's an equal opportunity to fix the problem, and people feel empowered, and that's what people need, is the opportunity to feel empowered that they can make something, make a difference, make a change, have an effect. It's become integrated into our culture that that's just what you do. And any one of us can speak out and say, "Hey, you didn't wash your hands. Do you mind washing your hands?" And people actually really love it when you come back to them and you say, "You had great hand hygiene. That was awesome. Thank you for doing that. Thank you for protecting our patients." And I find that people light up with a smile. They love it.